Hi, this is Sean Gross from SeanGross.com, Real Patients in Real Time. Today we're going to look at scapular depression and shoulder extension. It's a great activity to get the scapular depressors to really set in and understand what their function is, and get the patient to understand what their function is as well before progressing to other therapeutic exercise. As you know, the scapular depressors are a lot of times sleep at the wheel in patients either in a chronic tendinopathy stage or post-operative stage. Brian is a former patient of mine who is good enough to demonstrate this today, and how we're going to set this up is we're going to get his head to turn to the opposite side. When we do that, we relax the left upper trapezius. If he was in left rotation, the left upper trapezius will be in a bit of tension, and I don't want that today for this. I want this to be nice and relaxed and soft. So what we're going to do is we're going to slide over 2 notches, and I'm going to cue him as a therapist. I'm going to have Brian bring his shoulder blade kind of down and diagonal. We're going to move his left shoulder blade down and diagonal toward the opposite side of his buttocks. That's exactly what I want. And I don't want that to raise per se, I just want that to hold that position. Now we're going to use the weight of his arm as a resistance for the scapular depressors. So as he holds that position, he's going to raise that arm, bring that up, parallel to the ground, hand about the level of the greater trochanter. We're going to hold for 2 seconds. 1001, 1002. He's going to slowly lower the arm, keep that scapula tight, hold it, hold it, hold it, hold it, hold it, and relax the scapula at that point. Beautiful. That was 1 rep, but it's like its own little set. He's setting it up, making sure he has the position, bringing the arm up under control. The scapula is actually lifting. Think of this as the barbell. Think of this as the muscle using the force to lift the barbell that is actually his arm. Again, let's demonstrate that again. Depress, push down, hold, raise. 1001, 1002, lower slow. Control, control, control is here as he lowers that arm, and relax. Now I felt a little bit of a slip away from the depressed position. We're just going to coach that out again. Push down, hold. Brian, lift that arm. Bring it up. Hold for 2. 1001. 1002, slowly lower the arm. Keep your scapula right where my hand is, keeping it tight, keeping it tight, keeping it tight, much better, and relax. Okay, what we would do 5 reps per set, maybe 10 reps per set, but again, each rep is its own little set. We might do 30 repetitions total per session before progressing to weight. We might go as high as 50 reps to make sure he greases the groove of that motor pattern of scapular depression. If we run into a problem where he doesn't have the ability to really consciously get that to go and lift the weight of this arm, we can have Brian slide over. Slide to your right, Brian. And what we can do is we can put this arm on the table and just have him depress. So we're going to depress, push that shoulder blade down, and lower that shoulder just a bit. Depress down, push. And he's just going to hold that there for a period of time, say 15 to 30 seconds per set, to really feel what muscles we want to work. I want him to feel a little bit of fatigue in here, and in here near the posterior shoulder, near the latissimus, near the middle and lower trapezius. We're going to hold that for 5 more seconds. Hold it tight, hold it tight, hold it tight, hold it tight, and relax. Let go. Now Brian had his arm elevated here, and I didn't want that. I want that arm on the table. This rests. He's just going to depress again, push it down. Perfect. We're going to hold that. Let's hold that for 15. He's going to be conscious to hold that there. The upper trapezius isn't doing a whole lot, which is fabulous. We're going to hold that position for another 4 seconds. He's going to relax it, let it go. That's the response I want. Once we can statically do that for a bunch of reps, say 5 to 10 reps over a session or 2, then we'll go back to the first position. And let's look at that one last time. Brian slides left, comes toward me, get that arm way off the table. That's relaxed. Push down. Hold, lift, hold for 2, 1001, 1002, slowly lower, keep it tight, conscious, and relax. And that was a perfect rep. Fabulous. Again, Sean Gross from SeanGross.com, Real Patients, Real Time.